Research is what is going to set Pennsylvania's medical marijuana program apart from any other medical marijuana program in the country. No other state has implemented a program like this one to help provide clinical, evidence-based research on the effectiveness of medical marijuana. In fact, since 1968, it has been the University of Mississippi that has been the only federally approved source of marijuana for medical research. And really only a handful of physicians nationally have been approved by the DEA to conduct research. And as a result, the research on and the supply of medical marijuana for research has been rather limited. The 8 universities and 3 clinical registrants joining me today will change that. These universities and clinical registrants will conduct research on the approved conditions under the medical marijuana law. This past February, the Medical Marijuana Advisory Board recommended that I approve anxiety disorders and Tourette syndrome as approved conditions for the program. I have conducted a very careful review of the literature available about these conditions, and I have decided that I will approve this recommendation no later than July 20th, and that will bring the total list of approved conditions to 23. Now, we hope to learn more about all of the approved conditions, the serious medical conditions, in the medical marijuana program. And really a key component to approving conditions is to stimulate research on medical marijuana with those conditions, such as now anxiety disorders and Tourette syndrome. The researchers behind me will have now 23 conditions to conduct scientific, medically based research that will not only help patients in Pennsylvania, but actually throughout the nation and worldwide.
So we plan to leverage our comprehensive HIV program at Drexel to assess the effectiveness of medical cannabis in treating chronic pain, PTSD, opiate use disorder in this particular population. So we will be focusing on assessing the patient safety. Thank you very much.
I was gratified 3 years ago when the Commonwealth placed very strong research proposals within Act 16. And as Dr. Levine pointed out, I believe this puts us, the Commonwealth of Pennsylvania, at the forefront of supporting research into the potential benefits of medical marijuana.
We are very much looking forward to, as my colleagues, starting a sort of multifaceted approach to the clinical research that we're going to begin. We are also going to sort of create a broad database of inquiry across the different conditions that are legal and supported by the state to look at what form and what dosing is most effective.